Inquiring minds want to know, Ken, what's on your radar today?
Well, as Robbie has covered extensively here on Rising, mask mandates are being reinstated in cities like Philadelphia and in universities such as Georgetown, extended in situations such as traveling on a plane, and in some cases just haven't been lifted, like for toddlers in New York City daycare centers. The reinstatement of masks made me wonder where this is coming from. What's the justification for this? So today I want to go over the data with you. Plus, I'll show you some surprising data from the CDC themselves. So let's start with Philly. If Philadelphia is reinstating masks, they must be seeing a significant surge in cases, right? Well, let's take a look. I think this graph speaks for itself. What are they doing? The cases are low. Look at this, extremely low. They're currently looking at a 7-day average of 176 cases per day, and that's in a city of 1.5 million. Now compare this to the little baby wave they had in September, which had them seeing about 450 cases per day, and that was during their baby wave. Now during their big wave in January, they were seeing about 5,000 to 6,000 cases per day on average. Again, today they're seeing 165 cases per day on average, and they're reinstating the masks. Now let's look at their deaths. We know deaths lag by a few weeks, but this here is showing that there's no reason to be alarmed. The deaths are low, very low. They're averaging 2 per day. But we don't know if these people died of COVID or with it. So a lot of places will list a person as a COVID death if they just test positive, despite them dying of other obvious ailments like cancer or injuries. Okay, now let's look at Washington, D.C., where Georgetown is. If they're reinstating masks, there must be a giant wave going around, right? Also, we've heard about that fancy gridiron super spreader event that infected Merrick Garland, Adam Schiff, and New York City Mayor Eric Adams, as well as about 70 others. Plus, Nancy Pelosi, who wasn't even at that dinner, also tested positive. So D.C. must be just like raging with this virus. Let's take a look. Here's D.C. Okay, so we can see that there's a slight uptick. It's a little more than Philly, but it's still very, very slight. And here are the deaths for Washington, D.C. They're at zero. So clearly, like Philadelphia, Georgetown University is re-implementing mask mandates while cases are very low. And maybe you're thinking that's exactly when to do it, before the cases get out of control. But by this logic, we can never take off the mask until we reach zero COVID. If the idea is to wear a mask while cases are low, and if COVID is never going away, then when does this end? So let's look at the U.S.'s overall cases. Since federal airplane mask mandates are staying in effect, they've extended them from April 18th when they were supposed to end, and now they're ending not until May. Again, cases are extremely low. They're going up, but they're very, very low. So is the plan to wear masks every time the ticker moves upward? COVID doesn't look to ever be going away, so there needs to be another plan besides masking up and, worst of all, keeping toddlers masked so as long as COVID exists and cases go up. Now, I'm going to show you this graph. This is from the CDC's own data, and this is from Justin Hart from rationalground.com. And the graph is based on data from the CDC. It's showing us counties with a population of over 100,000 and their 7-day average of cases per 100,000 people. So the blue line represents counties that had mask mandates, and the orange line are the counties that didn't. Now, the counter to this is people say not everyone is compliant. Mandates can be in place, but it doesn't mean people follow them. Okay, fair enough. Now, if you remember, people often pointed to Asia as the exemplary model of masking. People in countries such as Japan, South Korea, and Taiwan have a culture of mask wearing, so compliance to the mandates haven't been an issue. So let's take a look at how they're doing. Now, most of these countries didn't see a big wave when the West and South America did. They instead are seeing their surge now, which is why Shanghai, for example, is under intense lockdown. So let's take a look at Japan. Now, you can see that huge spike and then a little dip, and they're now going back up again. Their 7-day average is currently at 50,000 cases per day. At the height of their big wave, they were seeing 100,000 cases per day. They all wear masks all the time. Here's South Korea. They're currently at 150,000 cases per day, and at the recent peak, they were seeing a whopping 400,000 cases per day on average. And again, they wear masks all the time with solid compliance. So we have everything we need for you to choose to stay as safe as possible from a negative COVID outcome. You can decide to socially distance, get the vaccine multiple times, take an early treatment drug, and yes, if you want, you can even mask up. But as the world is finding out, preventing transmission seems to be very difficult, and every mandate we've tried besides extreme social distancing and total border lockdowns before a virus gets into the country has been unsuccessful at accomplishing it. So lots of questions here, just wanting to go over the data. I know, Robbie, you're very, very much, you've made yourself clear many times on this show about how you feel about masking. But, here we are reinstating some masking in some areas, not allowing the masking to drop in others. And I think there is just a general question that we need to ask, which is, what is the goal? What are we trying to do?
Yeah, there are a couple of, I think, devil's advocate questions that I might want to ask. One, how much research there is about the efficacy of, say, the KN95 or the better quality masks versus some of these paper masks and cloth masks that people have been wearing. And also about the efficacy of the one-way masking. If one-way masking and a high-quality mask is getting the job done, then obviously the arguments for having mandates goes way, way, way down. But I do think, Kim, you make a compelling point that there are these other places that seem to have been implementing and reinforcing mask mandates pretty consistently that don't have big differences in outcomes.
Yeah. The CDC has acknowledged, I believe, the benefits of one-way masking, or they've acknowledged that that's a solution. People who want that extra level of protection, absolutely, they should be able to make that choice, 100%. But for everyone else who has, particularly for people in a situation, many people have already had it, or maybe even already had it multiple times. They might be vaccinated and boosted. They might just not have to. They might not be afraid of COVID more than they would be afraid of catching a cold, or the kind of seasonal illness that most people come down with. It doesn't make a lot of sense to me to impose on all of society mass restrictions or requirements when that basically we've gotten COVID to that stage. You can make a different argument for the earlier stages of the pandemic, but look, we're in a stage where we're going to see upticks in cases periodically, probably forever. We're not going to get to COVID zero, and countries that are still charting that course look pretty authoritarian and miserable. So learning to live with the virus, I think, means devolving the choice to individuals, and I really thought we'd gotten there, but places like Philadelphia, many college campuses. I think DC, I don't know if they're going to bring back the mask mandate or not. It wouldn't surprise me if they wait until, 3 weeks from now, 3 weekends from now, the White House Correspondents' Dinner, and then as soon as that's over, they say, oh yeah, now masks are back. Like the rich, wealthy, the political people, as long as they got to have their party with maximum fun, which is another part of this that we talk about frequently, about how the compliance mostly falls on the least powerful.
Well, Kim, I'm curious. The other thing I was thinking of is this conversation about how some of the data is affected by the reality that testing is not as frequent as it has been in the past. It's a possibility that if we're seeing such high-profile figures, even like Nancy Pelosi and all of these politicians come down with COVID, there does seem to be a little bit of a gap cognitively for me as I'm trying to understand all of this, all of that happening, and actually experiencing in my personal life, a lot of people, it seems, are getting COVID again in a spike, and the lack of a change on the graph. Could that be in part because we're not testing? People are going to the hospital with flu-like symptoms and reporting that they're not even given COVID tests in that context. We have a lot of these home tests that Joe Biden sent out, and people are kind of testing in the privacy of their homes and not reporting through any kind of mechanism. Are you concerned at all that we might not have an accurate picture of what's going on with the disease, especially because it's politically advantageous for Biden and the Democrats right now to say that they've got this under control?
Right. Well, the one thing that we can't fudge are the hospitalizations and the deaths. So even if the testing is lagging or people just aren't testing as much and they're catching COVID and we're not recording that, we do know whether or not people are showing up at the hospital, and they're just simply not. So, and even with the Omicron wave, we saw fewer people going to the hospital than what we saw. Like for Philadelphia, for example, they saw way more hospitalizations at the very beginning of the pandemic back in early 2020, in that spring. Way more hospitalizations, way more deaths and hospitalizations, but particularly deaths, than they did even even during the Omicron wave when they had way more cases than they had in that first wave. Now, the first wave, they may have had many, many, many cases, as to your point. They just didn't test and they didn't know that they had all the cases. But we saw that the hospitals did, they had a significant number of people showing up and needing to be hospitalized. That is not happening right now. So now what they're saying, of course, is, well, we're trying to prevent that. That's why we want people to go back and mask up, because we're trying to prevent the spread, which would then hopefully prevent the hospitalization. But we don't even have, clear data at this point on how deadly or severe this latest new variant is, the cousin of Omicron that's even more virulent. We don't know. And so, but to go back to masking, again, you can't wear it all day, every single day. And we know that the place you're going to most likely catch COVID is at home. Somebody comes home, they've got it, and then you're sleeping and you're circulating the air.
I can't wear it any time of the day. I can't wear it for another minute longer. I will just be perfectly honest. I'm not going to.
I will say, Robbie, unfortunately, that I wouldn't be surprised if they bring back the mask mandates in the fall, when we definitely see the waves surging through.
People rise up.
Well, I think the one other point
I'll join you.
That is worth noting is that there is a lot of buzz in the disability community about what the obligations are, that even if most of us, because we're vaccinated, aren't going to, succumb to COVID, the worst effects, as you were pointing out, Kim, in early 2020, were because a lot of people, of course, were getting very sick and dying before the vaccines were out, that there are people who are immunocompromised and have other things going on that are similarly vulnerable. But that is why I'm so interested in this question about one-way masking. If people can stay relatively safe and protect themselves if they have a different threshold for illness, then that really does eliminate one of the biggest arguments for mask mandates. But interesting as always, Kim.
Oh, thank you. All right, we'll have more Rising after this.